those who are sick, the shut-in, and those who do not know you. May someone come and cross their path and share the news of Jesus with them. These and all blessings I ask in the name of your Son, our Lord, and our Savior, Jesus Christ. Amen. I'm going to talk about headaches this morning. I feel like it's something that could be relevant to everyone, and there's a lot to say about it, but we're going to just break it down into small bites so that you can have an understanding. So headache disorders are painful discomfort. It's felt in the head and the neck and the shoulders. They're widespread, and almost everyone has felt a headache. The statistics show 50 to 75% of adults had a headache in the year 2020. Often the headache is just short-term and it's mild and it just goes away on its own, but some can be debilitating and disrupt your daily life. So there's several kinds of headaches, and we will not talk about all of them. But they can be caused by various factors like our environment, the medication we take. So we can take medication that can cause a headache. That just kind of seems off. And then there's other causes. So common causes of headaches. A headache occurs either because of a primary cause or a secondary cause. So if it's primary cause, the headache is the problem, okay? A secondary cause is something else is going on that causes you to have a headache. I'll try to break that down a little bit better in a minute. So primary headaches, they're like migraines or tension headaches. These are the most common headaches that lead people to seek medical treatment, and about 3 billion people a year, okay? It's primary because it's the main concern. And often things like stress or disruptions in your sleep pattern can cause these headaches. Secondary headaches. Secondary headaches manifest as a symptom of another health disorder, okay? So like if you have infection, like infection in your spinal column, it's called meningitis. Infection in the sheath that surrounds your brain, that's called encephalitis. So those things can cause headache. Medication overuse, high blood pressure, high blood pressure, high blood pressure. If your blood pressure is high enough for you to get a headache, it's high. Okay, because I've said many times that high blood pressure is the silent killer. So if you're feeling something, then your blood pressure is really high. Mental health conditions, head injury or trauma, like concussions. You know, our young people that play soccer or football or, you know, almost any sport, baseball, you know, concussions is an issue. Strokes, tumors, nerve disorder, sinus congestion, okay? Tension headaches. The tension type headache is the most common. So they can significantly affect the quality of life if you're affected with it. It causes head pain that can occur across both sides, the front and the back of the skull. So sometimes you just feel like your entire head hurts. That's a tension headache. The pain tends to be mild to moderate, so sometimes people with tension headaches can even ignore it, you know, and keep on going because it doesn't cause major disability and it's not aggravated by their daily physical activity. But if untreated, it can become chronic and it can lead to complications like disruption of your sleep, jaw and muscle joint disorders, because you know you're clenching that jaw, anxiety, depression, okay? Cluster headaches are not very common. They are more common in men than in women. They frequently occur throughout the day. The symptoms are brief, but they can be very severe. Pain's usually focused around one eye, and then you get tearing and redness in that eye. And sometimes your nose runs and you become congested on the same side of the face and the eyelid will droop. So now you think you're having a stroke. But it's a cluster headache and it goes away too. The medication overuse headache. So there's a million things that you can buy over the counter to treat a headache. And so everybody self-medicates and self-treats their headache because that's what it says. Excedrin, migraine, ibuprofen, Tylenol, etc. So, but the long-term and excessive use of medication that treats a headache can cause a headache, okay? They call it a rebound headache. That's another word for it. So what happens is you've treated that headache so long with those products that if you take it away, then you get a headache that's rebound. So that means it's bigger and stronger than the headache you had in the first place. It most commonly occurs with chronic migraines or tension headaches. And usually you've taken medication for at least 10 days in a month for more than 3 months. So if you're taking medicine that much for your headaches, I would recommend that you see a doctor. And maybe they can get you something that works a little bit better. Other primary headaches there's exercise headaches, and that's a type of headache when you participate in strenuous activities or exercise. There's no nausea or vomiting, but you just get pulsating pain, okay? It's important that there's no nausea or vomiting because that's more common with like meningitis or something that's more serious. And then they have something called Hemicranial Continua, which just means a headache on one side. Okay, it always occurs on one side of the face and the head, and it can be severe and constant in people who have this, and they have to seek help. So if you have a one-sided daily or continuous headache that's moderate to severe in intensity, and then you get these piercing head pains, and you feel it for more than 3 months, then you should see a doctor. This kind of headache actually responds to an anti-inflammatory medicine called indomethacin, which they also use for gout. Okay. Pregnancy headaches, they're very common in pregnancy. So you can experience stress and significant hormonal changes, which might actually lead to contributing to the headache. The important thing about pregnancy headaches is a lot of those over-the-counter medicines are not safe in pregnancy. So you try medication-free things like ice packs or going to the doctor to see what's actually safe. All right, so this is the big one, the migraine headaches. Okay, migraine is a primary headache disorder. It's recurrent and it's often lifelong. Usually the pain is intense, it's throbbing, and it's only in one area of the head. I find that we as people just use migraine interchangeably with headache. Oh, I have migraine. But a migraine is a specific type of headache that has certain characteristics. So besides your head hurting in that one area, you usually have nausea with or without vomiting, light sensitivity, we call that photophobia. So you got to turn all the lights off because the light is making your headache worse. Sound sensitivity, people talking or loud noises or even continuous noises aggravate the headache. This type of headache is more common in women, 2 to 1, compared to men, and they think that might be attributed to female hormones. Migraine headaches can be predictable because some of them start with an aura. So an aura is a visual disturbance. It can appear as like flashing lights in front of your eyes, zigzag lines, you temporarily lose vision, right before you have a headache. So people who have this know that, uh-oh, I'm about to have a headache. And incidentally, with the medications to treat migraines, to treat an acute migraine, they work best if you take it at the first sign. So that means when you see that first flashing light, then you go medicate. You don't wait to get the headache. Sometimes migraines are preceded by what they call a prodrome or a pre-headache. So you get a headache before the headache. Okay. So there's stages. They've got a phase that can occur as early as 3 days before a migraine, where you just feel like really fatigued, your mood changes, you get some muscle tenderness. Then you get the aura, that's the light, the visual disturbance. And then you get the actual headache, which is throbbing pain or the associated symptoms like the nausea, the vomiting, the light sensitivity, etc. So those are the stages, okay? Migraines can last from hours to days, okay? So it's important to recognize that it's a migraine, recognize what brings on the migraine, and then work with someone to find the cure or the medicine that can stop yours or break the cycle of migraines. When I was in training and people used to come into the emergency room with migraines, the goal was to break the cycle, okay? So what we would do is we'd give them some medicine for nausea, some anti-inflammatory, and you give it to them IV so it gets in quickly. And what happens is they go to sleep, because that nausea medicine knocks them out. And when they wake up, the migraine is gone, okay? So part of the treatment is the restoration of getting some sleep and just breaking that cycle. Children can get migraines. And sometimes because they can be younger children and can't express things as well, they might say their stomach hurts, or be extra irritable or extra tired, and even can get diarrhea. So as far as the female part of migraines, the reason why hormones are a difference, it's not just pregnancy, because pregnancy you have a change in your hormones, but females have menstrual cycle or they have menopause, and each of those things are changing the hormone levels acutely. The use of oral contraceptives, so if you're on birth control pills, you're changing hormones as well. And incidentally, if you have migraines with aura, it's recommended that you don't take birth control pills, okay? You have to have some other form of preventing pregnancy. And then a lot of women who've had a hysterectomy or after menopause or during menopause are taking hormone replacements, and that can also contribute to migraine. There's a whole bunch of triggers for migraine, so it's important that you figure out which one is yours. And when I finish this list, there's pretty much nothing left off. So everything can be a trigger. So activity, exercise, bending over, lifting over your head, inactivity, jet lag, alcohol, wine, beer, and hard liquor, or just drinking too much, allergy or sinuses, pollen, pollution, seasonal allergies, sneezing, congestion. Then there's auditory things, loud music, acoustic, environmental noise, like just traffic, emotional issues, anger, anxiety, fear, sadness, depression. And then food or eating, caffeine. Caffeine is a big one. It's not so much the caffeine, but the withdrawal of caffeine that leads to the headache. Certain foods, dehydration, soft drinks, not eating a nutritious diet, skipping meals, hunger, then hormones, medications, trauma, changes in sleep habits, smells, stress, environment, and motion from a vehicle. So that's why I say it's important to find out what your trigger is, because otherwise you just can't leave the house. You got to lay still somewhere and not move, because otherwise it's going to cause a migraine, in general, if you subscribe to all of the triggers, which no one really does. So the visual triggers were the brighter flashing lights, computer screens, glares, fluorescent lights, and even the sun. When to see a doctor. If you're experiencing headache symptoms 3 or more times a month, it may be time to see a doctor, okay? Also, you and the doctor together can consider preventive treatment if the headaches impact your quality of life or cause additional problems like stress, depression, or other concerns. So in general, if you have more than 2 headaches in a month, we recommend preventive treatment. Preventive treatment is tricky because the medications that are used to prevent headaches and migraines are not originally designed for that purpose. So people are very hesitant, to start on something that they have to take every day to prevent a headache when it's not, quote, headache medicine. So it's important to talk to your doctor also if you're having new headaches or a different type of headache. So you might be on treatment that's working and then you get something new, you still need to revisit. So when you go to the doctor, what are they going to do? Basically, they're going to take a good history, because analyzing the medical history and when they started, how frequent they are, the characteristics, the triggers, what worsens it, what makes it better, whether you have an aura or not, is going to lead to the diagnosis more than anything else. Sometimes they'll have you complete a migraine questionnaire. That way they can get that information quickly and go straight to the matter. Potentially, medical imaging is necessary to rule out other causes, to make sure you're not having secondary headaches. So in that case, it's usually a CT scan or MRI. So that we rule out stroke and tumor, because every single person that has a headache that comes out of nowhere thinks they are either having a stroke or a tumor, okay? And so sometimes doctors have to be sensitive to that and know that until you rule those things out, none of the treatment that you give is really going to work, because in the back of their mind, they have a stroke or a tumor. The obstacle there is insurance companies who may not pay for the imaging, but it's worth a try. Performing an eye exam, because your eyes are in your head and they contribute a lot to the headaches. A routine eye exam that can rule out a vision or eye concern might be all that you need. And then ordering blood lab tests just to see if there's something else that's going on. In some cases, you need to have a lumbar puncture, which is a spinal tap. And that's how you can see, diagnose the brain inflammation or infections. And bleeding on the brain can be seen on the imaging, but also if you get a spinal tap, you probably would find out that way too. So migraine treatments, the acute treatments are non-steroidal medicines like ibuprofen, indomethacin, naproxen. I think those are the ones that I can think of right now. And there's some nasal sprays that work. The mainstay of migraine treatment are a class of medicine called triptans. And triptans work by constricting blood vessels, okay? Because when you get a headache, the blood vessels are dilated, sending more blood to the area, and it hurts. So the triptans constrict the blood vessels back down to the size that they were to restrict that blood flow and pain. And that's things like Imitrex, Relpax. I'm not very good at brand names because I work in a generic name place. But those are the mainstays. So the preventive treatments, remember I just said they were not designed as preventive headache treatments. So what's used is anti-seizure medicines, antidepressants, antipsychotic medications, blood pressure medicines called calcium channel blockers or beta blockers. And then there's newer medicines that are injectable, that are like immunomodulating medicines that you can take a shot once a month to prevent your migraines if your insurance will pay for it. So other alternative treatments include heat therapy or ice. You know, it kind of depends. Heat makes more sense, but ice works for some people. Dietary changes, acupuncture, massage, oxygen therapy. It's very common for the cluster headache. It's just give some oxygen and it goes away. Caffeine. Most of the over-the-counter migraine medicines, the active ingredient is caffeine, if you read the label. And then there's some people whose migraines are bad enough that they need procedures. So like surgical procedures, or yeah, I guess they're surgical if anybody's touching you. So they do nerve blocks, like inject some medicine to kind of block the nerve to stop the pain. Trigger point injections. Botox is a big one. And then there's alternative treatments. Sometimes we just give magnesium as far as the preventive medicine, and riboflavin, which is a B vitamin, B2. And it has amazing results for some people. Relaxation training, biofeedback, cognitive behavioral therapy, mindfulness and meditation, hypnosis, yoga, once again, acupuncture, aerobic exercise, and diet, right? So that is a lot. There's also, if I can get my thing to work now, there is something called Acupressure and Reflexology. So experiencing the pain and discomfort of a headache is incredibly common. If you're looking for a more natural way to treat your headache, you might want to think about acupressure and pressure points. So pressure points are parts of the body believed to be extra sensitive, able to stimulate relief in the body. So practitioners of reflexology, which is a discipline of Chinese medicine, believe that touching pressure points in a certain way can improve your health, ease pain, and restore balance in the body, okay? Reflexology is the study of how one part of the human body is connected to another. This means you might have to massage a different location, like your hand, to treat a different area, like your head. So there's a couple of different areas, and I'm just going to talk about them because this won't do you any harm. So if it doesn't work, it just doesn't work. But what if it does? And so for me, I'm saying if we have the possibility that it can work, let's just see what those points are. So the first one, if I can get to it, they call it Union Valley. But it's that point that's located on the web between your thumb and your index finger, like right here. You see this little area right there, okay? So if you use it to treat headaches, you start by pinching the area with the thumb and the forefinger of your other hand firmly, but not painfully, for 10 seconds, okay? So you do your 10 seconds, 10, okay. Then next you make small circles with your thumb on this area in one direction for 10 seconds. And then you go in the other direction. You circle in the other direction for 10 seconds. And you repeat that process on your opposite hand. It's worth a try. And it's like, you're telling me to massage my hand to get rid of my headache? Hey, try it. Because I'm going to try it with my next headache. Drilling bamboo. My husband does this one. I don't know if he knows that it's drilling bamboo, but he does. It's located on the indentations on either side of the spot where the bridge of your nose meets the ridge of your eyebrows. So like right here, like right here. So you use both of your index fingers, you apply firm pressure to both points at once, and you hold for 10 seconds. You release it, and you repeat it. So they said that touching those pressure points can relieve headaches that are caused by eye strain, sinus pain, or pressure. Okay, so that one's particularly good for that one. The next one is gates of consciousness. I think this one would be the best one for me. And it's on the back of your neck. If you just feel back there, there's a natural indentation on both sides between your vertical neck muscles. And so to use these pressure points, you go right up like at the base of your skull in that place on both sides. You place your index and middle fingers of either hand on those pressure points, and you press upward on both sides for 10 seconds. So you're going like this, pressing up, and then you release and you repeat, okay? This one, I believe, is particularly good for the tension. Yeah, the tension headache, and especially the tension in the neck. And then I think this is the last one. It's called the third eye. So that one is basically right in between your eyebrows. So it's a little bit higher than that drilling bamboo one. And you use the index finger of one hand to apply firm pressure to this area for 1 minute. So that's a long time. But they said that firm pressure applied to the third eye is thought to relieve eye strain and sinus pressure also. Okay, there is one more. It's called the shoulder well. So here's our neck. It goes into the shoulder area in the very back, so it's kind of wider than the other one, okay? The shoulder well. It's located on the edge of your shoulder, halfway between your shoulder point and the base of your neck. So you find that. You use the thumb of one hand to apply firm circular pressure to this point for 1 minute. Then you switch and repeat on the opposite side. So you're not doing both sides at once on this one. They're saying do one side and then do the other side, okay? That is said to relieve the stiffness in your neck and shoulders and relieve neck pain to prevent headaches caused by this kind of sensation, right? So more research is needed. I'm not telling y'all that this is the definitive way. It's not well studied, but there's limited research already that suggests the massage of the head and shoulder can relieve headaches. So why not try these things? And as I said, because it's non-invasive, it's non-pharmaceutical way to treat headaches, it's very safe. So you can remember that it's a complementary treatment. Seek out some medical help if it doesn't work or if you have recurring or very intense headaches. One more cause of headache that I just wanted to touch on is concussions, just because I mentioned it. Concussions and other head injuries. If you've experienced a head injury or a concussion, you could be dealing with an ongoing headache. They call it Post-Concussion Syndrome. And it can last for a few months, and sometimes up to a year, okay? So symptoms of Post-Concussion Syndrome include the recurrent or ongoing headaches, fatigue, dizziness, periods of irritability, difficulty concentrating, short-term memory loss, feeling anxious, ringing in your ears, difficulty sleeping, and sensitivity to sound and light, and blurred vision. You can also even have a lessened sense of smell and taste. I just point that out because sometimes, especially like in our kids, it might not have seemed like a bad injury or something like that. They have better protocols now for sure, where they're keeping their eye on our athletes, but if they're experiencing these extra things, then it's a good idea to get them looked at and take them out the sport for there. There's a COVID-19 headache. I'm just saying there is one. Sometimes that's the only symptom that people have of COVID-19 is a headache. And that's obviously not well studied because the virus has not been around that long. And that would be all of the headaches that I prepared for today. If anyone has any questions, I am here.
Can we get a copy of those relief notes?
Yes, I actually put it on a Word document, just those things, and I'll send it to somebody. Okay, and you guys can have that. And it actually has like a little figure that shows you the points on it.
You listed sinuses under migraines, so is a sinus headache considered a migraine headache?
No, sir, but sometimes a sinus headache can lead to a migraine headache if you're prone to migraines. So a sinus headache is just a headache that's caused by that extra congestion or extra fluid in there that's putting pressure on it. And so that one's probably easier to treat than the migraine because you just relieve the pressure. Okay.
Sometimes, like when you drink some real cold, sometimes it's extra.
Yeah, they call that brain freeze. That's what they call it. But the good thing about that one is it goes away. You know, you drink it real cold, you sit there for a minute, and it just goes away on its own. All right. Thank you.